We'll be discussing one of the biggest issues confronting the country today, which is the ongoing strike by resident doctors. Now, across many hospitals, patients are facing delays, cancelled appointments, and in some cases, no access to care at all. Now, at the core of this industrial action are long-standing grievances, poor working conditions, irregular allowances, pay disputes, and a lack of equipment in our hospitals. Resident doctors, who form the backbone of service delivery in teaching and federal medical centers, argue that their welfare has been neglected for far too long. Strikes like this are not new. For years, the same issues of remuneration, training and hospital infrastructure has triggered repeated shutdowns, leaving citizens to bear the brunt. Now, the government insists it is making efforts to address these concerns, but for many, these disputes will never see lasting resolution, or whether the cycle of strikes will continue to weaken the health system. Now, to help us analyze the issues and better understand the doctors' demands, we're joined via Zoom by Dr. Tope Zenith Osundara, President of a National Association of Resident Doctors. He will share insight on what the doctors are asking for, the challenges they face, and what steps might bring this strike to an end. Good morning, Dr. Osundara. Thank you for joining us on Daybreak.
Good morning. I'm pleased to be here with you.
Good morning.
Thank you
for joining us.
All right, Dr. Osundara, let's dive right into it. So how long has the association been engaging with the government before resorting to a strike, and where the key demands, put forward, because this is not the first time nor the second time, but the key demands put forward to the government before the strike commenced, and of those demands, which would you say are the most urgent and non-negotiable for your members?
All right. Thank you. The issue have been perennial. We've been there. It is not the first time we are getting, across to them to tell them all of our demands. So they are fully aware of contained in our communique to them. So these are not new things. We've always been there, like I mentioned. So it is up to them to now expedite action on the demands.
So as of this particular point, which are the demands that are most important, that are non-negotiable to the members?
Okay. The non-negotiable is one, the payment of MROTF 2025, the downgrading of membership certificates, which was done by the Medical and Dental Council of Nigeria, and the payment of arrears of Commerce 2023.
All right, then, on welfare and working conditions, I mean, you have...
allowance.
Okay. Please go ahead.
7 months accoutrement allowance. You can go ahead. You can go ahead. I can hear you now.
All right, then. Thank you. So let's look at, on welfare and working conditions, which you have been able to state, most of, the key things that doctors are asking from the federal government. Now, we've heard about, unpaid salaries, hazard allowances, poor working conditions, the upgrade of the certificates you just rightly mentioned, and what have you. So how badly are these, all of this affecting the daily life of a resident doctor? And I also want to know, can you share an example of how this directly affects patients' care as well?
Okay. The first thing I would want us to know is that the life of the doctor, the welfare of doctors is not properly attended to. That doctor will not be mentally fit, emotionally fit to address of our patients. And in the long run, what you get to see is that you see patients who are not satisfied with the service delivery. And of course, has been always said that an hungry man is an angry man. And we do not want to discharge any negative attitude towards our our patient rather. So it is important for governments and stakeholders in this matter to address this issue and take care of the welfare of doctors. Now, the way it's affecting us, I mentioned the issue of the payment of MROTF, that's the Medical Residency Training Fund, for 2025. This fee or this money is meant for exams, and some of these exams, people are already writing it. They have to go and borrow money to write these exams. They have to, look for money one way or the other, and a large number of them are unable to meet up. So invariably, they are going to lose 1 year. Keep asking ourselves, who compensates for the years lost, for the time wasted? I'm pretty sure, that answer is just going to hang in the air, and nobody is going to be able to address matters like that. And the issue of areas of since 2023, commerce areas 2023 till now, it has not been paid. It's even tingling to the ears that areas of 2023 commerce till now, 2025, it has not been paid. We've waited for so long, we've endured for so long, and it is important that these issues are addressed. Same thing with the accoutrement allowance. And I also mentioned the fact that the downgrading certificate, this matter has been before the Ministry of Health, the MDCN, the National Postgraduate Medical College, and we've been talking about it, and it seems as if nobody is giving us a listening. We are not satisfied. We are not comfortable with it now.
All right, now, Dr. Osundara, now that the National Association of Resident Doctors have put forth their demands to the federal government, how would you assess the government's response to those demands so far? Are they proactive, indifferent, or reactive under this new pressure of a strike?
All right. I want to say kudos to the Honorable Minister of Labor and the Minister of Finance, who came at the nick of time. They called us yesterday. We were able to have a dialogue with them. They made some promises, but my people are not satisfied with just promises. They want evidences, and they want the fulfillment of these promises palpable. That is the saving grace, because the strike is supposed to have started by 8 a.m. today. But they've given the government 24 hours to address. There is nothing done within this time frame of 24 hours. Industrial disharmony inevitable.
All right. For each time, doctors threaten to go on strike, and eventually they go on strike, it always affects the patient at the end of the day. So how can doctors and also the federal government come together to balance everything? When we look at your ethical duty as a doctor is to pay attention to the patients, right? So how can this not affect the patients at the end of the day while doctors fight for their rights?
Well, it is only the federal government that can address it, because they are employers, and it is within our right to agitate for what is concerning to us. The labor law does not go against when a worker is dissatisfied and is able to express that dissatisfaction to the employer. We have expressed that dissatisfaction. So to have an harmonious relationship and continuous service delivery, it is the onus is on the government, is on the employers to do the needful, address concerns, address issues. And of course, we do not want to be on the road. We do not want to be on the streets. We don't want to be on the air discussing issues about our welfare if the property. So to have continuous service delivery, the onus is on the government to ensure that welfare and other matters as contained in the communique sent to the Ministry of Finance, Ministry of Health is addressed properly and squarely. So to have this continuous service delivery to the patient, like I've said, it is on the part of the government to fulfill their part of the bargain.
All right, Dr. Osundara, we know that when it comes to the healthcare, and as rightly mentioned by my colleague right here, the patients are rightly affected as well when it comes to the strike. Are there any contingency measures that are put in place to ensure emergency care, is taken care of during the strike? Because at the end of the day, with, your ethical medical practice, ethics when it comes to your medical practice as well, there has to be some sort of way around making sure that the patients are okay as well, even though you're out to get what is right for, the resident doctors.
All right. For now, if the strike is on from tomorrow, it is going to be total. It is not going to spare the emergency services. It is not going to spare any aspect of the service delivery in the hospital system. So it's going to total, though it is a 5-day one-day strike. That is the mandate of the members of my own association. So there won't be, sparing of emergency services. Emergency services will also be shut down when the strike eventually happens. The government will do the needful within the space of 24 hours so that there won't be disruption of service delivery at any level.
Okay, so if government were to meet just one of your demands immediately, now which one would restore enough trust for doctors, not to go on strike?
To take it holistically will be the best, the best approach to it. And it is simple. There are low-hanging fruits that the government can easily tap into. The MROTF 2025 is so easy for the government to just look into them and pay once and for all. The issue of downgrading of membership certificates is also a low-hanging fruit that the government can also address. That one is just issue, maybe a letter saying to implement, giving our members the membership certificate and upgrading it from the present level it is and bringing it back to the normal position. And, like I mentioned, it's a accoutrement allowance is also the money involved in this is not that much. It's something they can pay. It's, I want to limit it at that. I don't want to be too derogatory with my utterances, but these are things that the government can do in the immediate. And I'm pretty sure once they do that, they assess what the government has been able to place on our table. And from there, of course, we'll give consideration to whatsoever has been done.
Okay, so if you feel it's that easy for the government to just, run through this, papers, the documents and what have you, why do you think it is, why do you think the federal government is dragging their feet in doing that? Because you just rightly stated that it's, it's something that is not too, hard for them to do. And if it's that simple, why is it that up till now that has not been implemented?
Well, everything contained in our list of demands, there is nothing difficult about it. It is just the political unwillingness of government to address them. We are not even supposed to get, to this, we are not supposed to get to this stage of trying to compel or get the government to answer to some of our demands. It shouldn't get to this. Ultimatum, giving government ultimatum, giving them 24 hours before for them to implement meet our demands and implement some of those things that have been stated in the answer. concern. So we are not supposed to get to the stage. But unfortunately, we are where we are, and we expect that they will do the needful. Like you mentioned, they are not things that are difficult. And the money we are talking about, it's the monies are, they are not too big, too exorbitant that the government cannot cough out from their purse.
All right, Dr. Osundara, as the president of the National Association of Resident Doctors, this is not your first industrial action. So what has been the most difficult part of leading the association during strikes?
I didn't quite get that. Please take it again.
I said, as the president of the National Association of Resident Doctors, we know that this is not your first industrial strike. So what has been the most difficult part of leading the association during strikes?
All right. The most difficult part is to, congregate members of the association and, present what the government is offering, and directing them or guiding them in making the decision, so that there will not be this industrial disharmony. But there is this distrust that has filtered minds of our members, and nobody seems to trust the government again. Once the government makes promises, there's this feeling that the government is just making empty promises, and they are not really ready to fulfill and abide with the terms and conditions that we both agreed on. So most of the time, this breach of trust has been, an issue for me to make them, see reasons with the government, but it has been difficult. So I think the government needs to improve on what they dole out as promises. So if you are making promises to people, to your workers, to employees, it is, you are duty bound to fulfill your own parts of the bargaining, so that people can trust you and you can leverage on this trust subsequent time. So the trust is not there, and that is one of the reasons why we've been having issues with government.
All right, so now what now happens if the government does not pull through with the demands that the NARD is putting forth?
Of course, if the government does not fulfill or answer to our demands, definitely the industrial harmony cannot be guaranteed. So, a strike is inevitable.
All right, talking about trust, and having, should I say, faith and hope in the government by the doctors, because for every, relationship between the federal government, the doctors, and any type of relationship, I mean, the bedrock is trust. So with this, do you think that, or rather, do you see room for collaboration between, NARD and government on systemic reforms, not just welfare?
Yes, of course, there is room for collaboration. There is room for dialogue, and it is part of what we are also trying to do, to work with government, such that we, when you go to roundtable discussion, you bring your own submission. Government can look into it and see what they can do to avert issues, just like what we are having. So there is room for collaboration with government. There is room for dialogue. We have astute, clever professionals who can negotiate with government and provide solutions to issues, surrounding the healthcare system in Nigeria.
All right, Doctor, quickly before we go, beyond these immediate welfare concerns like salaries and hazardous allowances and other things that you've mentioned, what structural reform does NARD believe are essential at this point in the healthcare sector?
Okay, the government to look into the policy issued by the Honorable Coordinating Minister of Health, thematic areas in this policy that the government can look into. But what we've seen is that we have only had the policy as a paperwork, but the implementation has always been the problem. So the government should look into how to implement the thematic areas in this policy. As part of what we can do as well, the government needs to look into how to safeguard the working condition of doctors and other health workers. It is becoming too burdensome. The workload is, essentially too enormous for us to cope with. So there is a policy that needs to be in place to safeguard the working hours of doctors. Excessive work is not too good for even the health of the doctor and for quality service delivery. So government needs to look into it, and government needs to look into issues of contract. So there is, the government needs to now begin to see how they can begin to fulfill, a collective bargaining agreement that we've had with government, so that there won't be industrial disharmony going forward.
All right, so thank you very much, Dr. Tope Zenith Osundara, President of the National Association of Resident Doctors. Thank you for joining us this morning.
It's a pleasure.